And the title for today is On the Trail of Substance Use by Israelis with Backpackers in India, Rave Partygoers, and People Who Inject Drugs in South Tel Aviv. So Hannah introduced me, so I just say that my research and teaching area include criminology and deviance, substance use, gambling, addiction, drug policy, focusing on young adults, backpackers, women, and people who inject drugs. So I would like to start with a little bit background about substance use in Israel. So cannabis is the most widely consumed substance in Israel. The prevalence of cannabis use has been on the rise in recent years, in the last decades. According to the latest drug and alcohol epidemiological national survey conducted 6 years ago, among adults ages 18 till 65, cannabis is the most prevalent drug in Israel. 27% reported using cannabis at least once in the past year, and 2% reported using other illegal drugs. The most common drug are NPS, new psychoactive substances, LSD, ecstasy, what we call MDMA, and cocaine. When we talk about heroin, it's about 0.25% reported heroin use in the past year. I want to show you also the drug routes into Israel. In Israel, there is domestic market for illegal drugs, but the drugs enter to Israel. Most of the drug enter to Israel. You can see here the map of Israel, and you can see the close circle of neighborhood countries that some of the substances come from those countries. They enter the land here, the borderland, from Jordan, for example, from Egypt, from Lebanon, inside Israel. This is the close circle, but we have also substances that enter Israel due to the air and seaports, and that's what we call the distant circle. Some substances like ecstasy, MDMA, come from Europe, for example. Some countries in Europe, as Belgium and the Netherlands. Also the cocaine, it's come from South America. And other countries in Asia, also we can see that heroin enter Israel from Southeast Asia, and NPS, new psychoactive substances. I would like to talk a little bit also about the legislation according drugs in Israel. So we have the Dangerous Drug Ordinance from 1973. And it's determines all drug-related offenses as possession, use, trafficking, import, export, etc. It determines a maximum sentence for most types of drugs. It's up to 20 years. But if it's self-use of those drugs and not trafficking, it's up to 3 years. But if somebody give it to minor, to adolescents, so the penalty is harsher, and it goes up to 25 years and mandatory prison sentence. One of the unique in Israel ordinance, that the ordinance does not distinguish between different types of drugs. You can see in other countries in the legislation, there is a list of drugs. There is soft drugs and hard drugs, but it do not exist in the ordinance in Israel because all drugs are considered the same. The same punishment that if you are export or import to Israel cannabis or if you are import to Israel heroin, it's the same punishment. That's what the law said. But in practice, you can see that the court and the judge tend to take the type of drug into consideration when they decide about the sentence. And you can see from that they give harsher sentence to heroin compared to cannabis trafficking, for example. I think this is the reason that in the last year, the ordinance changed according to cannabis use. And I want to present you some of those changes. This is cannabis use. You can see here the picture of cannabis. I took this picture in India, in North India. I will talk about it later. You can see that in India it's growing wild, and this my picture that I took there. So in Israel, as I said before, cannabis very, very common. And we have cannabis for medical purposes and cannabis for recreational purposes. So cannabis for medical purposes is permitted only for those who obtain a license. And currently, around 125,000 patients have received permits for use of cannabis for medical purposes. According to the Israeli Ministry of Health, it is the highest rate of cannabis patient relative to its population worldwide. So it's very high yes, this number. Also, there is cannabis for recreation proposed. We can see the changing in the regulation. In April 2022, cannabis was formally decriminalized. I should say that it's began 3 years before of that, but it was temporarily in 2018, and in 2022, it's become formally decriminalized by adult over the age of 18. If adult over the age of 18 will use cannabis possessed for self-use, and that's mean 15 grams or less of cannabis, generally not enforced by the authorities. So we can see that cannabis is the most widely consumed illicit substance in Israel, but not only in Israel, it's worldwide. That is the reason that we wrote this perspective article. We wrote about cannabis tourism destination. I wrote this perspective article with Moran Segiv-El-Ayuf. She is a medical doctor, and she is also involved in tourists and backpackers who use drugs and so on. So what we realized that in recent years, more countries have decriminalized, as I said about Israel. Israel also in the last year decriminalized cannabis, and some countries also legalized cannabis and have become cannabis tourism destination. And what we write here in this article, we identified the most common cannabis tourist destination, and you see here at the table, we put all the countries that attract people because cannabis tourism. So we talk about Amsterdam, Netherlands. We talk about Colorado in the United States. Colorado was the first state with Washington to full legalize cannabis. In Amsterdam, it's not legalized, it's decriminalized from 1972. Canada from 2018 is fully legalized the cannabis in the federal, in all Canada, not like the United States that only some countries make legalized. In Canada, it's all the country. Uruguay was the first country in 2013 that made full legalization of cannabis. After that was Colorado and Washington and so on. In Portugal, it's decriminalized, but it decriminalized for all substances and not just cannabis. And it's begun in 2001. And India, no decriminalized, no legalized, but let's see how India, as I said before, this picture, it's wild grow, the cannabis wild grow in India. And we can see also that backpackers and tourists that visit India also see and use cannabis. So Amsterdam in the Netherlands is one of the cannabis tourism destination. I think it was the first cannabis tourism destination because the first coffee shop, like you can see here, the net of the bulldog, but there's a lot of coffee shop. I think right now it's more than 160 coffee shop in Amsterdam. And the first coffee shop established in 1972. So Amsterdam was one of the first cannabis tourist destination, attract a lot of travelers that want to use cannabis. You can see also here the cookies that they sell in those coffee shops and so on. Also, I talked about Colorado. Colorado was, with Washington, the first state in the United States that legalized the cannabis. And I visit Denver, Colorado. My journey to the cannabis industry in Denver, there is cannabis industry. You can see this is one of the dispensaries that I visit. It's called Medicine Man. This is the area where if you want to recreational cannabis, you can buy to yourself. And there is a huge selection of cannabis products because it's industry, and always there is a new planets and new strains and so on. But one of the problem that I saw in my visit, I said about visit because I'm also anthropologist, and a lot of places that I've been in the cannabis tourist destinations, I look in these places like in the eye of anthropologists. So a lot of pictures, and I write a lot of things about this. And one of the problem that I saw in Colorado, for example, is the edibles. Because it's industry, it's not only strains that you can smoke the cannabis, you can also buy products to eat. Edibles like cookies, like chocolate, like lollipops, and so on. And this is the reason that there's a lot of young kids and tourists also going to emergency care because of that edibles. This is the reason why Colorado also make a campaign to that say that this from their campaign in 2018 that say keep it safe in a safe, lock your weed away from kids and pets. This is the reason not to go to the emergency care because eating too much chocolate in this way. So cannabis tourist destination, we can see that Israeli backpackers going also to cannabis tourist destination. I should say that the post-army, you know, in Israel, there is mandatory army for young adults after high school. They go to the army, and after the army, there is the post-army backpacker trip. So the post-army backpacking trip among Israeli young adults to Southeast Asia and South America has become a significant social phenomenon in Israel society over the past 25 years. Substance use is common among Israeli backpackers and also among other backpackers from various countries, not only among Israelis, but I study the Israeli, but I have also studied international backpackers but Israeli use a lot of substance. The most commonly used drugs are cannabis, products such as marijuana, or called also ganja in India, and hashish, or jaras in India, hallucinogenic mushrooms and cacti, LSD, ecstasy, MDMA, what we call cocaine, ketamine, and more substances. In the field of substances, always there is a new substances, always, yeah. So this is the reason why Moran Sagiv-Elayuf, the medical doctor, and me also write this article, make this study, because for some drug-using backpackers, rescue from their trip abroad is necessary. And Moran Sagiv, as a medical doctor, she go to rescue those backpackers. And between the years 2011 to 2016, there was 86 cases. And what we did in our article, in our study, we want to map from where the rescue and why. So most of the rescue, it was because of substances use. The backpackers need rescue from the country. So the highest rescue cases came from India. You can see here in this period of time, India is number 1, 36 cases came from India. Number 2, Thailand, with 8 cases, and number 3 is the Netherlands, with 4 cases of backpackers that need rescue because of substance use. India was, most of the backpacker rescue came from India. I should say that India is a country that's very popular among Israeli backpackers. They love India, India, beautiful. I've been in India in 2013, and I took those pictures, about the wild cannabis grow in northern of India. Of course, it's not in everywhere. It's in some places that it's grow wild, and it could confuse the backpackers. It's legal or illegal, but cannabis is illegal in India. You can see here our questionnaire. This is the backpacker, Israeli backpacker in one of the village in north of India. And this is our questionnaire, and you can see here joint, and these cookies, they have inside hashish. So those backpackers, they answer our questionnaire when they use also cannabis products, and so on. So it's very common. It's common also in Israel, as you saw before, okay? This in the airport when we want to go back. So we met those police officers with the dog unit K9. This is a police dog in Delhi airport, India. They detect also drug smuggling from India and into India, as it's occur in a lot of countries, included in Israel, as I present before, the map of Israel and the borders and so on. Another country that was number 2 in the rescue of Israeli backpackers due to substance use is Thailand. I love Thailand very, very much. And all the years, Thailand have strict laws against drugs. Thailand have developed a reputation for its hardline attitude and war on drugs policy for both local and tourists, including long incarceration and even the death penalty for drug-related charges. You can see here picture of full moon party when the moon is full. So the rave began, the party began in Kopangan. Pangan, it's name of island in south Thailand. And there is party when the moon is half now and so on. So what amazed me about Thailand, this is me in August last year. I've been in the International Psychiatric Conference It was in Bangkok in Thailand, and I was shocked because 1 month before I come in August 2022. 1 month before, 1.5 months before, on June 9 June 2022, Thailand implement a drastic policy change and become the first Asian nation to decriminalize cannabis for locals and tourists. And it was amazed me. You can see it's like, it's not like the coffee shop that I saw in Amsterdam or the dispensary that I saw in Denver, Colorado. It was different because it's like vendors. It's like people who bring their tables and sell cannabis. It's like it was overnight. Thailand changed a drastic policy according to cannabis. It so amazed me because I visit Thailand before, and I know the strict law according to drugs, and it was shocked me. So I decided to write about it. So I write the perspective in the Journal of Travel Medicine. And I said, what happened? What happened to Thailand that now it changed very hurry to change and drastic changing of the cannabis policy? And it was amazed me. And in this time, also my friend Sharon Horsky, she is from the Hebrew University of Jerusalem, from the business school, and she returned from the Netherlands. And also she amazed what happened now in the Netherlands after the pandemic. Because Thailand and all the countries, they start to open to tourists very lately because of the pandemic. So Thailand, for many years, the economic of Thailand, it's depend on tourists, and the pandemic make a huge problem with the economic in Thailand. So we realized that to lure back, to attract tourists back to Thailand, they change the cannabis, and also the talk about gambling policy changing. They want now to build a casino in Bangkok, because to lure back, to attract back tourists come again to Bangkok and Thailand. This was the post-pandemic occasion. And what Sharon Horsky saw in the Netherlands was the opposite, because the Netherlands, Amsterdam especially, considered as a cannabis tourist destination for many years, and make nonsense. And a lot of residents of the Netherlands, they complain about it. And the mayor of Amsterdam, she decided maybe now to finish the coffee shop, or to change the coffee shop, or to change Amsterdam from being a cannabis tourist destination. And we wrote about it, and because of the amazing of how it's changed, how it rapidly changed, the cannabis policy change. And 1 month after we published our article, 3 medical doctors from Thailand, the response to our perspective, and they wrote a letter to also the Journal of Travel Medicine, and they said a recently publication by Hagit Bonny-Noach and Sharon Horsky has raised concern about Thailand and so on, and they agree with us, and they also put their perspective about the issue now, what happened now in Thailand. So what will happen in the future in relation to the cannabis policy change in Thailand? I don't know, but now it's a year from the changing, and I think that nothing drastic or dramatic happened. So maybe this is the way, I don't know, but maybe in the future we will learn and know more. The backpacker trips is also connected to the rave scene in Israel. The roots of the Israeli rave scene, it's start in late 80s, developed by backpackers, Israeli backpackers, that returning home to Israel from their travel to the state of Goa in India and the island in southern Thailand, where they were exposed to electronic music parties associated with substance use. So this was the root, the connection that I made now between the backpackers and the rave party goers in Israel. But in Israel, there's a lot of raves, and a lot of people that participate in those rave. The rave scene in Israel, also called electronic dance music, or natural parties, or forest, or trance. Those nicknames, it's stem from the location of the parties, which is usually outdoors, or after the musical genre that dominates them, the nickname of those parties. In Israel, the common name is natural party, mesibot teva in Hebrew. So Israel raves, party goers, only a few studies have been conducted among Israeli natural party or rave attendees, and almost all of them are from qualitative perspective. So we decided to conduct a quantitative, first of its kind, quantitative research. When I said we, I have we are a team of research, 8 researchers. We conducted quantitative research to investigate the patterns of substance use, harm reduction. What is harm reduction? I will explain. Attitudes and behavior among Israel natural rave party attendants. What is harm reduction? Harm reduction, it's policy that I think it's very important policy, okay? Harm reduction aims is to minimize the negative health, social, and legal impacts associated with drugs. You can see here, for example, this is from the newspapers, in Israeli raves and all over, I think, raves all over the world, there was a death of young ravers that come to dance and died because they took substance too much or do not drink enough water and so on. So harm reduction is to prevent those, to minimize the health consequences of taking drugs during raves. So there is organization of harm reduction that goes to rave parties and establish a safe place to people who feel a little bit sick because they are dancing and took drugs and so on. And I do think harm reduction is very, very important. And our research conduct also to show that. And we found that the use of drugs at natural nature parties is very common compared to the general population. You can see here our finding. We conducted among 1,206 participant, rave party participant. The most common illegal substance use in those rave is cannabis, of course. In the last years was 62%, followed by LSD, it's hallucinogenic substance, MDMA, mushroom, psilocybin inside the mushroom, it's also psychedelic, ketamine, and cocaine. You can see here in lifetime use in the last year and in the past month. The prevalence here is very, very high. compared to the general population. I just mentioned in the first slide the substance situation in Israel according to the National Epidemiological Survey, and it's very, very low. But if we go to unique population as party goers, it's backpackers, young adults in general, we can see that among those group, there are more prevalence of substance use as we found here also in rave party among participants. We published, according to this research, there's some articles that we just writing about this study, and one of them published lately. It's considered the attitude to law enforcement, to the police, how the party goers, how they consider and what their attitude to the police. And it's very interesting. And if somebody that listened to my presentation want to read deeply some of those articles that I present, I will send it to you. It's okay. So the last subject that I want to present is ethnographic study that we conducted in Israeli largest open drug scene. I conduct this ethnography with Sharon Toys, Dr. Sharon Toys. We published it in 2019, but it's began a few years before. We call it, I just explained what is open drug scene, but those pictures are came from the field. You can see here envelope of condom. You can see here siren and water here in the open drug scene. So what is open drug scene? The term open drug scene is commonly described as geographical area where public trade and use of drug occur. While open drug scene has been known for more than 4 decades in various cities in Europe, North America, and Australia, in Israel it's relatively new, having started to take shape in the mid-2000s. This is me here. This is my legs here. This is the man who tried to inject in this case, it was heroin, and he sit like this for hours because he cannot find the right place to inject and so on. Typical open drug scene are located close to transportation hubs and in central businesses districts. The largest Israeli open drug scene is in the poorest part of South Tel Aviv, in the area of the old Central bus station. The open drug scene in Tel Aviv is concentrate and contain large gathering of hundreds of people who use drugs. Concentration lead to ghettoization and raising a crime rate. You can see one picture from the nights. We spend the time there. While ethnographic, you make a lot of observation and a lot of informal conversation with the people gathered in this place. And this is the place at night. You can see it. You can see here where we stay, the main street that we've been for more than 3 years. It was the Solomon streets here and all the little streets around it. This is the Solomon Street by night. You can see here like this. This area, it's considered a crime hotspot. The place is widely known as to be the marketplace for illegal substance and high level of violence. Place where people who use drugs gather, drug dealers, homeless people, people who engage in sex work, thief, undocumented migrants, refugees from Africa, and more. You can see those people, they look very in not good shape. If I say it, you can see those. I will explain later what we suggest is the solution for what to do next in this area. The population that gather in the open drag scene is defined as hard to reach population. This population is difficult to access, unknown, have no fixed address. They are not under the spotlight of research and does not generally agree to be interviewed. They live and make their living from the streets. They drop out, run away from home and from the police, and may experience mental illness, trauma, stress-related disorder, substance use disorder, dual diagnosis, infection disease, as well as engage in deviant behavior and criminal activity. This population that they are great challenge in collecting data from them. So this is the reason why it's very important to conduct an ethnographic study in open drag scene, because of the hard to reach population, because this population do not agree to interview in other way. Ethnographic is well suited for gaining access to hard to reach population. Only a few of the study conducted in recent year in the open drag scene have been ethnographic. Ethnographic observation conducted in natural environment that is beyond the control of research. So our ethnography, it was unique, okay, in this place. Understanding drives from ethnographic study can help formulate strategy to induce behavior change and can assist in the formulation of policy on public health, drug treatment, and social services. So it's very important, I think, as a anthropologist, to make ethnographic research also in those places. So our method, briefly, we made a participant observation during the nights and day. We conducted 62 informal interviews. We maintained reflective research journal. This is our informal interview. We made it with men, women, and trans women that gather in this area. A lot of people engage in sex work, a lot of people engage related to substances use and so on. Just to say that entering the field was a little scary in the beginning. It was very scary in the beginning, and we feel very unsafe in the beginning. It was also difficult to know how to behave and what to talk about. One of the challenges is to become accepted and not associated with authorities, with the police and the power they control and they possess. We need to build trust with the target population, that we can be in touch with other like themselves, like a snowball sampling, or introduce us to their world, what we call in anthropology, gatekeepers. You can see our one of key informant. He worked in sex shop work. He was a sex shop worker, and he let us come inside and take pictures and so on. The dominant addiction in this area, in the open drag scene, it was the substance addiction. It was visible and above the surface. We saw a lot of injection, people who inject drugs. We saw a lot of drugs. All kinds of illegal drugs are sold in the compound, but opioid as heroin and fentanyl in the last year was dominant. Also the NPS. A lot of people inject drugs in this area. They inject opioids, but also chagigat. It's a street name for amphetamine type stimulants. They also inject Ritalin and mixed substances. All of the people who inject drugs were in poor physical and mental condition. You can see that visible drug injection among men. We saw it a lot in the compound. Among women, it was mostly invisible and more hidden. The women also inject drugs, but it wasn't so visible like we saw the men there. What we saw also, it's a gender power relation. One of the things that we made in our research is to see which power relation we see in this compound. And we saw the dominance of masculinity on the main resources, on drugs and money. So the man was in the top of the hierarchy. The people who controlled the area was a drug dealer. There was very violence also, and also the police. Trans women who engage in sex work, it was in the middle, and in the bottom was marginal men and also women. Woman was in the less in the hierarchy, in the bottom of the hierarchy. Marginal people, women and men who hit rock bottoms, of the society. They are in poor physical and mental condition. The homelesses at very lowest level. They are not the regular homelesses that we see in other neighborhood in Tel Aviv. The people that come, the homelesses that come to those area of the central bus station of Tel Aviv, of the compound of the largest open drug scene, the very lowest level. People who use drugs at the very lowest level, and street sex worker at the very lowest level. Women experience everyday violence. They are in the bottom of the hierarchy of the power in this compound. The violence came from drug dealers, from clients, from pimp or boyfriend, and sometimes from the police. Violence was part of everyday life. Rape, beating, murder, humiliation, verbal and emotional violence. We realized that the marginal population, women and men, described the place as hell, as the lowest place in Israel, a trash can, a violent everyday. So we ask ourselves, so if they think about this place in this terminology, so why do they come to a place like this? So we understand that the place offers something that they cannot get from society at large. The largest open drug scene is a very functional place for marginal people. This is a place they can meet their basic need. They sleep there. They can receive their food, drink, and drugs. Drug is like a medicine for them. A place where they can earn money, because nobody want to hire them. Nobody want homeless to employ. They cannot earn money in other way. So this place was functional place to them. They get their social contacts and with peers and human warmth, a place that receives them all without condition, a kind of refugee area for them, because the society do not give them this kind of warmth and acceptable. They said when they go to hospital or something, everybody look at them because they look different, because they feel very stigma according to them. This place is a meeting place. They can meet with peer group, a place to hang out, a feeling of equality and belonging. It was a private place for them, like home, without social control and stigma. So why we decided when we write our article about this research, about our ethnographic and so on, this is Sharon, the next PI in this research. And we began to become activists. We want to change the reality. We become radical criminologists who want to make a change. We do not want to stay as a fly on the wall, and we suggest some radical solution that not everybody agree with those radical solution. I really appreciate harm reduction policy, and I really want to promote harm reduction policy and intervention for this population. You can see two of my articles that I write about harm reduction. This is a mapping of harm reduction drug policy in Israel, what has been accomplished and what still needed to be done. And this more direct for this population, the need to establish the first safe consumption site in Israel. That's mean I want to promote the establishment of a consumption room that people can come to a place to inject the drugs. These consumption sites exist in Europe, in Canada, also in New York, also in Portugal. Lately, it's become. In Canada, there's a lot of them. In Australia. So I really think that also in Israel, because it cannot be. You saw our pictures from the ethnographic, how they stay and try to inject drugs. I should say just. In the beginning, we do not took pictures. We just write what we saw in the observation. But when we start to determine and say we want to change the reality that we saw in this area, so we start to take picture, because sometimes pictures, policymakers see in their own eyes what happened and not just what is right, and so I really want to make change and to promote harm reduction in Israel in all area of drug use. And thank you. And this is my email. And if somebody want to read deeply my articles, I will send it to you. Thank you very much.